So, search interest in exosome therapy has just exploded this year. We're talking like a 557% increase year over year.
Oh yeah, it's everywhere.
Right. And you've got people out there shelling out thousands of dollars completely out of pocket for this invisible, heavily marketed miracle treatment that's supposed to fix, well, everything. Male pattern baldness, osteoarthritis, anti-aging skincare, you name it.
And they market it so aggressively.
Exactly. But despite this massive commercial boom, there is a pretty terrifying detail that you really need to know before you ever let a needle near your skin. And that is that there are currently exactly zero FDA-approved exosome products for therapeutic use in humans. Like zero.
Zero. I mean, it is the absolute definition of a diagnostic and regulatory gray market.
Yeah.
You have this massive influx of patients who are just desperately seeking regenerative medicine, and they are stepping completely outside the traditional invisible safety net of modern healthcare.
Right, because normally you just, get a prescription from your doctor.
Exactly. You take the pill, and you trust the massive regulatory apparatus that guarantees the pill is actually what it says it is. But in this space, that safety net simply does not exist.
Which is exactly why we are pulling apart this topic for you today. We have a huge stack of sources sitting right in front of us. We've got FDA warning letters. We're looking at strict guidelines from the International Society for Stem Cell Research and some really comprehensive clinical white papers.
There's a lot of material to go through.
It is, yeah. So our mission for this deep dive is to basically decode this gray market for you. We want to figure out how the truly ethical clinics actually cut through all that marketing noise, how they transparently present the origin and the processing of these therapies, and what a legitimate informed consent process actually looks like when you are dealing with, experimental science.
That really is a crucial starting point because the underlying science of exosomes, it's genuinely promising.
Oh, for sure.
The danger here isn't the biology itself. The danger is the massive gap between promising, controlled laboratory results and safe, standardized clinical treatments.
Yeah.
Regulators are treating this with extreme caution. And once you understand what an exosome actually is, that caution makes perfect sense.
Right. So let's start right there with the biology. Because a lot of these clinics, they aggressively market exosomes right alongside stem cells, almost using the words interchangeably.
Oh, all the time.
But they're fundamentally different.
Right, they're entirely different. I mean, the biggest misconception driving this whole market is that exosomes are living cells. They are not.
Right.
They cannot reproduce, they don't have a nucleus, and they cannot transform into other types of tissue the way a stem cell can. Biologically speaking, exosomes are nanoscale, lipid bilayer, extracellular vesicles.
Okay, let's go around that in reality for a second. A lipid bilayer is essentially just a microscopic protective fat bubble, right?
Basically, yes.
It just keeps whatever is inside safe from the harsh environment of the bloodstream.
Precisely. It is this highly durable little fat bubble, and they are infinitesimally small. We are talking typically between 30 and 150 nanometers in diameter.
Wow.
Yeah, you could fit millions of them on the head of a pin. And our cells naturally release these vesicles all the time. It's just part of normal biological communication.
But they aren't just empty bubbles floating around in there. The real magic is the cargo they carry.
That is where the therapeutic potential really lies. They carry highly active biological cargo from the originating cell to recipient cells elsewhere in your body.
Right.
This cargo includes complex proteins, lipids, messenger RNA, and microRNA. And this is where the mechanism gets really fascinating.
Yeah, break that down for us.
Well, when an exosome reaches a target cell, say like an inflamed cell in a damaged knee joint, that fat bubble merges with the target cell's membrane. It actually drops off its cargo, specifically the mRNA.
And that mRNA acts like a line of biological code, right?
Exactly.
It actually enters the recipient cell's ribosomes and provides a totally new blueprint. It's essentially telling the damaged cartilage cell to stop producing inflammatory markers and start pumping out anti-inflammatory tissue-repairing proteins.
You nailed it. It reprograms the recipient cell at a genetic and metabolic level.
So we aren't transplanting the whole biological factory here. We are just mailing the cellular text messages.
That's a great way to put it.
Yeah, like if a mesenchymal stem cell is the factory that makes the healing components, the exosome is just the envelope containing the specific instruction manual.
And that is the core hypothesis of the entire field. Researchers realize that, hey, if the exosomes are the actual messengers doing the heavy lifting, maybe we don't even need to transplant the entire living stem cell.
Because transplanting living cells has a lot of risks, right?
Oh, absolutely. They carry significant risks. They can be rejected by the host. They can differentiate into unwanted tissue, or they can trigger massive immune responses.
Yeah.
But if we can isolate just the exosomes, we might be able to deliver those powerful regenerative signals without the risks of administering living cells.
Which is a super elegant solution in theory, but because that lipid bubble is so tiny, separating it safely from dangerous cellular waste is just a biological nightmare.
A total nightmare, yeah.
And that precise nightmare is why the FDA refuses to treat this like some simple blood draw.
Well, the processing is where everything falls apart in the gray market. Because you are dealing with nanoscale particles, if the isolation and purification process isn't absolutely perfect, you aren't just delivering a healing message.
Right.
You might actually be delivering cellular debris, mutated proteins, or unintended biological signals that can trigger severe systemic reactions.
Which brings us to a major red flag we see over and over in the source material. A lot of these pop-up clinics, they try to skirt the rules by slapping a quote-unquote 361 compliant label on their websites.
Yes, I see that constantly.
They try to compare their little exosome vials to something like PRP platelet-rich plasma, which is derived from your own blood and is relatively loosely regulated under Section 361 of the Public Health Service Act. But biologically, treating an exosome like PRP is totally absurd.
It is legally and biologically false.
Yeah.
Section 361 applies only to human cells and tissues that are minimally manipulated and intended for homologous use.
Homologous meaning it does the same thing.
Right. Homologous use means the tissue performs the exact same basic function in the recipient as it did in the donor. So PRP fits perfectly because the doctor just takes your own blood, spins it in a centrifuge to concentrate the platelets, and injects it back into you.
But exosomes are not a simple spin and inject procedure.
Not at all.
I mean, to get a therapeutic dose, laboratories have to take donor cells, usually mesenchymal stem cells, and culture them for days or weeks in a bioreactor. They have to force the cells to multiply, stress them out to make them release exosomes, and then put that resulting liquid through intense ultracentrifugation and chemical filtration. That is maximum manipulation, not minimal.
Furthermore, taking exosomes derived from an umbilical cord and injecting them into someone's scalp for hair loss or into a knee for osteoarthritis is the very definition of non-homologous use.
Right, because that is definitely not what those vesicles were doing in the donor's body.
Exactly. Therefore, the FDA explicitly classifies exosome products as Section 351 biologic drugs.
And a Section 351 classification is not just a suggestion.
Right.
It means the FDA looks at this and says, you are creating a highly complex new biologic drug. And that requires an investigational new drug application, an IND, just to be tested in humans.
Right, just for the testing phase.
Yeah. And then to be marketed legally, it requires a full biologics license application, or BLA. It's the exact same billion-dollar, multi-year, rigorous process required for any major pharmaceutical drug.
And the manufacturing realities for a 351 biologic drug are incredibly intense. I mean, to even approach clinical grade quality, these laboratories have to operate under strict good manufacturing practices, or GMP.
Let's break down what GMP actually means in this context, because we're not just talking about wearing gloves and a lab coat.
Oh, no, it's way beyond that.
We're talking about entirely closed system processing. At no point can the cellular material be exposed to the open air, because even a microscopic airborne pathogen could contaminate the whole batch.
That's right.
And then there's the endotoxin testing.
Endotoxins are particularly dangerous here. They are essentially the dead outer shells of certain bacteria.
Wait, so even the dead shells are toxic?
Absolutely. Even if you sterilize a product and kill all the living bacteria, those dead shells remain. And if they get injected into a patient's bloodstream or joint space, the patient's immune system detects them and mounts a massive, violent inflammatory response.
Wow.
Yeah, it often leads to high fevers or severe joint swelling.
And because exosomes are invisible to traditional microscopes, you can't just look at a slide to see what you have. Labs actually have to use nanoparticle tracking analysis, or NTA.
Yes, NTA is crucial.
They basically shoot a specialized laser into the sample and track the scattered light as the particles bounce around. That is literally the only way to accurately count the concentration of the fat bubbles.
Exactly.
Plus, the final product usually has to be lyophilized.
Right, freeze-dried.
Yeah, freeze-dried at -20°C, because if you just leave these fragile fat bubbles sitting at room temperature in a vial, they degrade.
Yeah.
The lipid bilayer ruptures, the mRNA breaks down, and suddenly you are just injecting expensive, useless water.
The required infrastructure is monumental. You simply cannot just whip this up in a backroom clinic with a tabletop centrifuge.
But here's where the mechanics of the industry get a bit tricky. Let's say I'm an ethical clinic. I want to do this right. I want to run a legitimate clinical trial under an FDA IND number. So I purchase a vial of exosomes from one of these highly advanced GMP-compliant labs. How do I actually know what is inside that vial? The lab isn't just going to hand over their proprietary recipe or their exact ultracentrifugation speeds to me, right?
No, of course not.
So how does a lab protect its trade secrets while still proving to the FDA and to my clinic that the product is safe?
That is the exact logistical hurdle that the industry faces, and the regulatory solution is a mechanism called a drug master file, specifically a DMF Type 2.
Right. So think of the DMF Type 2 as like a high-stakes vault between the manufacturer and the FDA.
Exactly. The manufacturer, the laboratory actually producing the exosomes, submits this extensive file directly to the FDA.
And it goes right into the vault.
Yes. And it contains all their highly confidential proprietary trade secrets, every exact quality control specification, every isolation protocol. The FDA holds this vault in strict confidence. The ethical clinic sponsoring the clinical trial never sees the recipe. Instead, the clinic simply references that specific DMF vault number in their investigational new drug application.
That is such a brilliant workaround. It completely shields the manufacturer's intellectual property, but the FDA still gets full visibility. The FDA can look inside the vault, verify that the biological drug substance is pure and safe, and then give the clinic the green light to proceed with the trial.
It is a vital mechanism for pushing legitimate science forward safely. It ensures that the patient is protected by federal oversight, even when the exact manufacturing details are a corporate secret.
So bringing this back to the listener, if you are sitting in a consultation room, how do you know if the clinic is tapping into that rigorous FDA-monitored system or if they are just running a slick marketing scam?
That's the million-dollar question.
Because you wouldn't let a used car salesman talk to you about a shiny paint job without demanding to see the Carfax report first, right?
Exactly.
In this world, an ethical consultation is documentation-led, not marketing-led.
The ultimate Carfax report in regenerative medicine is the Certificate of Analysis, or COA. An ethical provider will happily hand this over to you before you commit to anything.
And what are we actually looking for on that COA?
First, it details exactly where the source cells came from. A high-quality source is often Wharton's jelly.
Which is the rich gelatinous tissue found inside a full-term umbilical cord.
Yes.
It cushions the blood vessels, and it happens to be loaded with pristine, highly active, day zero mesenchymal stem cells.
Right. The COA will verify that origin. Then it will show the results of third-party testing. It will prove the batch has been tested for sterility, viral safety, and those dangerous endotoxin limits we discussed earlier.
No dead bug shells.
Exactly.
Yeah.
It also proves batch-to-batch consistency. If a clinic cannot or will not provide a clear certificate of analysis, you should immediately walk out the door.
Our sources actually outline a pretty clear list of red flags and green flags when vetting these clinics.
They do, yeah.
Let's break down the red flags first. Number 1, any claim of FDA approval or FDA clearance for an exosome product. Like we established, there are 0 approved products.
0.
If a clinic claims otherwise, they're lying, period. Second red flag, evasive answers about the origin of the product. If they call it a quote-unquote proprietary blend or secret cellular matrix instead of just telling you it's derived from umbilical tissue, run.
Absolutely run.
Third, guarantees of a cure. And fourth, comparing exosomes directly to established, approved therapies to make them seem equally safe.
And on the flip side, the green flags are all about transparency and oversight. A massive green flag is a clinic operating under a verifiable, FDA-issued IND number.
Meaning they treat it like a trial.
Exactly. It means they are treating the procedure as a formal clinical trial. They should also have an institutional review board, or IRB, overseeing the process to ensure human subjects are actually protected.
And ethical clinics usually utilize a multimodal approach.
Yes.
They don't just push exosomes as the first and only option just because it has the highest profit margin. They offer established, FDA-compliant alternatives first.
That's right.
For example, if you go in for joint pain, an ethical doctor will discuss PRP first, because PRP actually has decades of randomized controlled trial data behind it, whereas exosomes are still investigational.
An ethical clinic leans into the uncertainty of early-stage science rather than trying to hide it. And that leads to the most critical interaction you will have in this entire process, which is informed consent.
Right.
Once you understand the biological origin and the investigational nature of the product, the clinic has to formalize that understanding.
According to the guidelines from the International Society for Stem Cell Research, the ISSCR informed consent is not just a digital form you blindly sign on an iPad in the waiting room.
Oh no, definitely not.
It is an active educational process.
The ISSCR and ISCT guidelines dictate a rigorous framework that must happen before a needle ever touches your skin. The primary goal is to entirely dispel what bioethicists call therapeutic misconception.
And that is the dangerous psychological trap where a patient mistakenly believes they are receiving a proven, guaranteed medical treatment rather than understanding they are just participating in an early-stage medical experiment.
Exactly. To break that misconception, there are mandatory disclosures. An ethical consent process must explicitly state 4 things.
Okay, let's hear them.
Number 1, the product has no FDA approval for your specific condition. Number 2, the treatment is entirely investigational. Number 3, conventional alternatives exist, and you are under no obligation to choose the experimental route. And number 4, which is the most important, the severe potential risks.
Because these are highly complex biological products, the risks are far more severe than, temporary swelling or a little bruising at the injection site.
And much more severe.
If the exosomes are poorly manufactured, improperly stored, or contaminated, the consequences can be catastrophic. You are risking severe immune rejection, massive unexpected inflammatory responses, and severe systemic infection.
The clinical white papers specifically highlight a devastating incident from 2019 in Nebraska to illustrate this exact point.
Oh, right, the Nebraska case.
Yeah. Multiple patients went to a non-compliant clinic seeking treatment for basic joint pain. But instead of healing, several of these patients developed severe sepsis and ended up in the intensive care unit fighting for their lives.
Wow.
The FDA actually had to issue a massive public safety warning.
That Nebraska case is just a perfect example of what happens when the manufacturing reality is ignored. I mean, exosomes suspended in their liquid medium are essentially a perfect biological food source for bacteria.
They really are.
If a lab cuts corners and skips the closed system GMP processing, or if a clinic just mishandles the vial, gram-negative bacteria can easily contaminate the batch.
Easily.
And when you inject that contaminated biological soup directly into a patient's bloodstream or a joint capsule, it triggers sepsis. It's a life-threatening chain reaction where the body's immune system starts attacking its own organs.
It is a stark reminder that when we bypass the regulatory framework, the stakes are literally life and death. And this ties directly into a legal concept known as the materiality standard in state medical laws.
Right.
Basically, the law dictates that a doctor must disclose any risk that a reasonable patient would consider important to their decision-making process.
And a reasonable patient absolutely needs to know that a contaminated vial could put them in the ICU with sepsis.
Exactly.
You cannot just gloss over that risk because you are afraid it might scare the customer out of buying a $5,000 treatment.
If a clinic minimizes those risks or calls an exosome injection a quote-unquote cure, they aren't just bending FDA guidelines. They are violating basic medical ethics and state-informed consent laws.
Yeah.
The psychological shift required by ethical clinics is profound. They completely change your identity in the room. They stop treating you as a consumer buying a luxury wellness product, and they start treating you as a protected participant in a medical investigation.
Which changes everything.
It does. You have explicit rights, you have independent oversight via an IRB, and you have complete transparency about exactly what biological code is entering your body.
It completely flips the dynamic of the doctor-patient relationship. You aren't being sold a shiny biological gimmick. You are collaborating in early-stage science with your eyes wide open.
And that is the ultimate defense we want you to walk away with today. When you are dealing with the bleeding edge of regenerative medicine, regulatory literacy is your shield.
Absolutely.
You have to understand the difference between an FDA-approved drug and an experimental biologic. You have to demand the certificate of analysis, and you must expect an informed consent process that fully embraces the stark uncertainty of the science.
You know, it's fascinating to look at where we are right now in 2026. We are navigating this incredibly murky gray market filled with donor-derived tissues, umbilical cords, and highly processed cellular text messages.
It's a wild time for the science.
It is. But as science gets better and better at mapping exactly how that mRNA code works inside the lipid bilayer, it raises a huge question about the future for me.
Oh.
Like, How long will it be before we stop harvesting these vesicles from human donors altogether?
Well, the ultimate goal of this biotechnology is almost certainly synthetic replication.
Imagine a future where we don't need umbilical cords or Wharton's jelly or massive stem cell bioreactors at all.
That would change the game entirely.
Instead, we just use a machine to artificially synthesize the exact lipid bilayer envelope from scratch. We pack it with a custom-printed mRNA instruction manual designed specifically for your exact injury, and we send that pristine synthetic text message directly into your knee to command the cartilage to heal.
No human donor variables, zero risk of adventitious agents,
Yeah.
just absolute engineered purity.
Exactly. It would completely eliminate the biological wildcard of human-derived tissues.
It is the logical, inevitable endpoint of decoding cellular communication.
But until that day comes, we are still operating in a world where the vials on the clinic counter might not be exactly what it seems. So the next time you hear a pitch for a cellular miracle cure, remember the actual science. Ask for the biological Carfax report, read the fine print on the clinical risks, and never settle for marketing over medicine.